cause knee pain as well?
Yes, there are many patients that have already had operations on their knee by orthopedic surgeons to try and help eliminate their pain. These procedures might be arthroscopic surgeries or even knee replacements, and despite these techniques, some patients still have pain. We are able to identify these patients and find out if their cause may be related to nerve injury. If their pain is related to a nerve injury, there's the possibility that by removing some of the nerves that are causing pain, that we can help reduce or eliminate their pain and restore their function that they've lost.
I would say my pain was a 9 to a 10. It was intense. The pain was aching and stabbing. I've been a gymnast since I was a little girl. I was always very active and was always running. I would run 5 to 6 miles a day. My knees had gotten worse as I've gotten older, and I eventually tore my meniscus. It was very hard going from being so active to just sitting at home in pain. Before Dr. Maloney, I'd seen 4 doctors and had 2 surgeries. I was getting nerve blocks, cortisone shots, and everything you can think of, but nothing helped. I went to a pain center, and this doctor knew right away about the pain I was having. He gave me a nerve block in which the results showed that my nerves were damaged almost beyond repair. He referred me to Dr. Maloney, who gave me peripheral nerve surgery on each knee. He extracted all the nerves that go to my knees. I could tell a difference in pain after the second week of my surgery, about the time the swelling and incision wounds healed. Since then, my pain level has drastically improved, and I can do physical activity again. I love to run. It's like therapy for me. I've always been really active since I was a little girl, and I love being outdoors and active. It's a stress reliever. Before my surgery, I would run 5 to 6 miles a day, and now I run 3 to 4 miles. I'm building up my endurance again. Dr. Maloney seriously gave me my life back. I was not active for a year and a half, and now I'm traveling to Japan. I wouldn't have been able to do that if it weren't for Dr. Maloney. Since Japan, I've decided that I want to go back and teach there, and thanks to Dr. Maloney, my life has changed for the better.
This patient clearly represents someone who's failed orthopedic management and has had a lot of different surgical procedures to try to help her with her pain. When we met this patient, it was clear to us after we performed diagnostic blocks in the office that a component of her pain was related to nerve injury. We were able to successfully treat her as an outpatient in a very brief surgical procedure lasting less than an hour, and we were able to significantly reduce her pain and help get her back playing the sports that she enjoys.
Today, more than ever, with the daily impact of what we subject our bodies to and the toll it takes, pain is becoming a more common part of our everyday lives. But it doesn't have to be. With breakthroughs in modern medicine and the emergence of new technologies, doctors are making great strides in finding more ways to provide relief from pain. Many types of nerve-related pain can be reduced or even eliminated. There's no need to live in constant pain. Call or email the Maloney Nerve Institute today and get started down the road to a pain-free life. What is neuropathy, and what can be done to help ease the pain?
Neuropathy is a condition that's usually an illness that has a lot of different causes that affects the nerves. But the one common thing that all patients with neuropathy have is pain and numbness in either their hands or their feet. So that's basically how we classify neuropathy. But the interesting thing about neuropathy is that there are some types of neuropathy where the symptoms of neuropathy can be helped with nerve decompressions. The most common example is carpal tunnel syndrome, where by performing an operation to relieve the pressure on the median nerve at the wrist can restore sensation and reduce the pain that people have from carpal tunnel syndrome. We've also discovered that there are other areas in the body where, just like the wrist with carpal tunnel surgery and carpal tunnel syndrome, there are other nerves in the body that can also benefit from decompressing the nerve. And those patients are identified through history, physical exam. So there are types of neuropathy that unfortunately cannot be helped. But the only way that we can identify those patients that may be candidates for surgery is by examining them and performing this test. So let's just start in the very beginning. Tell me a little bit about when you first developed pain and what kind of pain syndrome you had. Where were you having pain? What was it associated with? Did you have any numbness with it or poor balance?
It was poor balance, burning sensation, and excruciating pain. I couldn't even get up out of bed without hanging on to stuff or grabbing a cane or crutches. And even if I had a walker.
And this was in both feet?
This was in both feet. One seemed to be worse than the other. I initially started going to a podiatrist, and he did all kinds of therapy or stuff. He gave me medicine that I was allergic to, so I couldn't take anything. And he just chose to continue trying to treat me. He even put cortisone in my feet. I got orthotics to be put in my shoes. I had to stop wearing heels and basically nice shoes, you know. I couldn't even wear nice flats because my feet hurt me so bad. And I don't know what you thought when I first came in, but you did help me. And I can walk. I can do a lot of things that I couldn't do before.
Well, tell me how long it was that you had pain and numbness before you met me.
It was since 2006. So from 2006 to August of 2008, or 2007, I'm sorry.
So over a year you had this type of pain. And how many different doctors did you see? I had seen probably my podiatrist, the therapist, my regular physician, a neurologist who said nothing was wrong with me. So that's at least 4 doctors that said basically it was in my head. Well, it was my left leg first in August of 2007. And I'm not one for surgery because I react funny to the anesthesias and stuff. But I woke up and I was able to walk out under my own power on my leg. Whereas before you required a cane and a walker, right?
Walker and crutches, yes, because I just couldn't get around. Anytime I'd put my weight on my feet, they hurt. And I was back to work. September, I went out dancing, so.
And how did it feel after we operated on one leg and made that better? You still had the other leg that was bothering you. How were the two different?
Night and day. Night and day. It was just awesome in the fact that I could put weight on my at least one foot. That helped me so much. Well, my balance improved 100%. I was always stumbling, tripping, and kind of staggering, almost like I was drunk. And it was just embarrassing because you'd be walking along normal and all of a sudden trip. Turn around and say, oh, watch out for that spot. But it was really neat that I was able to pick up my feet. I was able to stand on one foot and then stand on the other foot. It was something that I hadn't done in years, and I didn't realize it until I was standing on one foot without realizing it. Well, I acquired a dog this past year and a half, and Charlie and I walk. I work 12 and a half hours Monday through Thursday. Or well, I'm away from the house 12 and a half hours. So we only walk about 1.5 miles during the weekdays. On the weekends, we walk at least 3 miles. So it's awesome. It used to be Charlie pulled me up the hill, now I pull him up the hill. To the physicians, I'd ask them to listen to their patients because the patients know themselves. They know what they're feeling. They may not be able to say it in medical terms, but they know what's going on with them. And if they're hurting, they need to get help. And I found that this surgery was the only help that I could get, and the only help that has helped. The downtime for this procedure is very minimal, and it is well worth it to be able to function as an active human being. And it's well worth the surgery. Dr. Maloney, before I met you and I had my surgery, my pain level was 10 out of 10. I felt like it was even more at times. But after I had the procedures done on my legs, I am 0. I can take my dog and walk him 3 miles a day, something I never could do before.
One of the most common causes of neuropathy is diabetic neuropathy. And diabetic patients, because of the metabolic condition and illness that they have, with their blood sugars being elevated, there are things that happen to the nerves all over their body, and they can typically get a pattern of symptoms of pain and numbness in both hands and both feet. And so that's a very common presentation. Now, the symptoms of diabetic neuropathy may be due to compression of the nerve, and that's the type of patient that we can provide surgical solutions to help them with their pain. And the reason is because the nerves in diabetics swell, they can get compressed or pinched in areas of tightness or narrowing in the ankles, in the knees, elbows, and in the wrists. And by relieving that pressure on the nerve, we can help restore sensation, reduce pain, reduce the chances of amputations and ulcerations, and even improve balance in those diabetic patients. The success rate in properly selected diabetic neuropathy patients is in approximately the 80% or higher range. And what that means, in carefully selected patients who have symptoms of neuropathy, meaning pain and numbness, poor balance, if those patients have their symptoms due to compression of the nerves, we can offer them surgery and oftentimes help restore their sensation, reduce their pain, and improve their function.
Today, more than ever, with the daily impact of what we subject our bodies to and the toll it takes, pain is becoming a more common part of our everyday lives. But it doesn't have to be. With breakthroughs in modern medicine and the emergence of new technologies, doctors are making great strides in finding more ways to provide relief from pain. Many types of nerve-related pain can be reduced or even eliminated. There's no need to live in constant pain. Call or email the Maloney Nerve Institute today and get started down the road to a pain-free life.